Hello, everyone. This is Chitra Saxena, Vice President of IASNM. Supporting this event, we have two executive board members, Dr. Ishani Dalal, who is nuclear medicine physician and has been practicing nuclear medicine and radiology for many years. She is the chair of Nuclear Medicine Board Review Committee at SNMMI. Ishani, to you, please.
Hi, Chitra. Thank you for nice introduction. Welcome, Dr. Baljinder Singh. It's our true honor that you have accepted our invitation to speak. Back to Chitra.
Our second executive board member is Dr. Deepak Behera, nuclear medicine physician, very well-known consultant in the field of clinical research studies. He is our IT backbone, which is he is information technology, intellectual technology, and very interesting technology. Deepak, back to you.
Thank you, Chitra, for the kind introduction. Well, let's put it this way. I guess I'm a consultant in the field of nuclear medicine, and I'm engaged in clinical development and medical affairs in the industry. Right. Thank you. Back to Chitra.
It is IASNM mission to promote the exchange of ideas, knowledge, technical expertise by welcoming speakers in our webinar named Chai with Scintillating Stars. In today's ever so changing world, it is both my privilege and a true honor to introduce a legend full of grace, compassion, leadership, and a shining star, a scientist leader in the field of nuclear medicine, Dr. Baljinder Singh. His accomplishments are far too many to list. However, few of his national and international accolades are as follows. He's a professor of Department of Nuclear Medicine, PGI MER Chandigarh. He's current president for Society of Nuclear Medicine India. He's professor in charge, cum registrar for PGI MER Chandigarh. He's Senate member for Punjab University. He's the chairman for the Institute of Biosafety Committee. He was international chair for Indo-UK radiation safety and security in healthcare from 2015 to 2017. He was a former dean for India College of Nuclear Medicine from 2015 to 2018. Dr. Singh has innumerable publications, and his tenacity for mentoring his students in MD, PhD, and MS program is just very, very unique. Recently, Dr. Singh was nominated by ICPO Foundation, which is International Centers for Precision Oncology, in which Dr. Singh will be creating theoretical and practical lectures pertaining to theranostics. Dr. Singh, welcome to our Chai with Scintillating Star. You have had an astonishing career. Can you kindly educate us on your fascinating, successful, and passionate journey? Your start in this field, what inspired you and enabled you to reach your milestone? Doctor.
Thank you, Dr. Chitra, for a very nice introduction. And I would like to tell you my journey in brief, that my education background through and through, from graduation to post-graduation and then to doctorate, is in biophysics from Punjab University, Chandigarh. And the course curricula in graduation and post-graduation in biophysics included a significant proportion pertaining to radiation medicine and radiation biophysics, and which I found quite fascinating. And the same encouraged and inspired me to pursue PhD involving nuclear radiation techniques in human healthcare. And with the aforesaid background, I joined the Department of Nuclear Medicine in PGI in 1994 as a senior demonstrator. Then I was appointed as assistant professor in 1997 in PGI in the Department of Nuclear Medicine. And subsequently, I got promoted as professor in 2010. After having spent 27 long years in the discipline, I have achieved great sense of satisfaction and have contributed by putting in my best efforts toward the growth of the specialty in India. I believe it is my hard work, sincerity, passion, national and international research collaborations, and I will rather say it is my sheer good luck that has enabled me to achieve excellence and great success to reach and occupy important positions in the specialty of nuclear medicine in India and have gained eminence amongst my peers internationally. That's my whole journey. This is how I got into nuclear medicine and established myself with my biophysics background and nuclear medicine. Both are integrated. So I think I could do a good job.
Yeah, absolutely. Fascinating, especially biophysics. Not easy. Thank you for that. Thank you. So if you were to go back in time, Dr. Singh, what would you do differently?
Yeah, this is a very tricky question. I think, as you've already told me, that I am professor in the Department of Nuclear Medicine and currently the president of Society of Nuclear Medicine in India. And I am also officiating as professor in charge of academics in a very primary institute, which is challenging in addition to my additional duties as president of Society of Nuclear Medicine in India. This post of professor in charge keeps me busy throughout the day. Sometimes I'm forgetting whether I'm a nuclear medicine professor or I'm a full-time professor academics, because this job is very challenging. You have to introduce new courses, MD programs, DM programs, and you have to change the course curricula. You have to start new courses. And all this is very challenging. At the same time, it's very, very satisfying. And as you said, in the past, I have held many important positions as Dean, Indian College of Nuclear Medicine, and as Senate member, Punjab University, NET, Indo-UK NET chair, and I'm also like Indian representative on a couple of international committees and national committees like DST, which is a funding agency, and ICMR, Indian Council of Medical Research. And currently, I'm also one of the members of the steering committee, where India, and I think everywhere, there's a shortage of molybdenum throughout the world. Actually, so India is making some alternative strategies how we can make production of molybdenum by other alternative cost-effective methods, because worldwide the nuclear reactors are going old, and changing these nuclear reactors involves a lot of cost actually. So I think there's a project funded by Ministry of Information Technology worth 150 crores, and Samir IIT Mumbai has been given the task to develop this new alternative method. That's by LINAC. LINAC is a machine which is used for radiation therapy, but at LINAC, if you escalate the energy up to 30 MeV, this can be very effectively used for the production of molybdenum. So I think we have had a reasonable success. I think they have already gone up to 20 MeV. Now, in the further step, they are going to 30 MeV, and very soon, we think that we will have the LINAC produced molybdenum technetium-99M for clinical use. So these are one of the challenges and one of the strategies where India is going ahead, and I'm one of the very important member of this endeavor of India in being self-sufficient in the production of molybdenum by alternate methods. So I think I have had coming from the entirely farming background and achieving and reaching pinnacle of success, I don't think the retake or recourse of my journey could be better than the current journey. And I have absolutely no regrets, but nevertheless, it is an ongoing thing. And we have certain challenges in the country. Like if you I just took the data that in the US, there are 4 PET scanners per million population. Okay. Whereas in India, we are at the very low side, 0.1 PET scanner per million population. So this is a great challenge. So even if we can't meet the standards of US, maybe even to have the reasonable number, 1 PET scanner per million population, we need to have close to 1,500 PET scanners, say, over the next 10 years. So all these are challenges in terms of economics and manpower. If you, we in India are catering to the population of 1.2 billion population. We only have 300 PET scanners. We need to catch up with the first world countries like US and Japan. And we are actually pursuing all these issues with the central government. And another challenge for India is we have to import all these isotopes, gallium, another isotopes, thallium, molybdenum from outside. And we are not able to provide services to our patients at an affordable cost. So we are pursuing, the Society of Nuclear Medicine of India is pursuing our mission with the Ministry of Health and Family Welfare and also with the Department of Atomic Energy, that's DAE. And fortunately, both of the ministers, Minister of Health and Family Welfare is also a doctor. He's an ENT surgeon, Dr. Harshvardhan. And the Minister of DA, Department of Atomic Energy, Dr. Baljinder Singh is also a doctor. He's an endocrinologist. So they have understood our goals, and we have, requesting the government of India, both the ministries, to have tie-up with some European unions, with the Russian government, who are very strong in producing these isotopes. Let them sign an MOU so that we can, under this MOU, and some funds are allocated for this kind of venture, so that we can make the nuclear medicine theranostics and diagnostic services to reach them at an affordable cost to our poor patients. So these are one of the challenges of the Society of Nuclear Medicine in India, and I'm pursuing it very, very aggressively. So the best is yet to come.
Very interesting, very interesting. Ishani, back to you for another question.
Sure. Looks like Dr. Singh, you face a lot of challenges, and hats off to entire team. I can clearly see that you indulge yourself in all the activities that promote the well-being of Nuclear Medicine Society in India. And very proud of you for doing everything and serving the community in such a great manner. My question for you is, who is or was your role model or mentor, or who had the most influence on you during this great career or successful journey?
That's a very difficult question, actually. I will just like to put it up like this. And you always have different role models at different stages of your life. Okay. And when I first joined nuclear medicine, I was very new to nuclear medicine field. Then we used to attend our annual meetings. And the first day of the annual meeting of the Society of Nuclear Medicine in India always used to be a joint workshop with IASNM. And all these guys, formative years of nuclear medicine in India, the US guys, they were very, very fascinating, like Professor Matthew Thakur, Professor Suresh Srivastava, and then very dynamic lady, I think you must be knowing her, she must be old now, Dr. Ramanna, Lalita Ramanna. So they used to come and give lectures on PET imaging when the PET was not available in India. So, they were very, very fascinating to hear them. And it was always a feast to listen to these guys, Matthew Thakur, bringing out new molecules for clinics. And then Dr. Ramanna used to be very, very well-established person dealing with thyroid cancers. And then Dr. Suresh Srivastava, another guy, and then of late, Professor Awais Alavi, the legendary of nuclear medicine. We always call Awais Alavi, these are not, we call him more Indian than actually American. Actually. So he has helped many colleagues there. So I can say that in the initial those years, all these guys, they were my role models. And despite being so accomplished nuclear medicine radiochemists, doctors, and they were so humble and pious, they were always ready to help any of us. And those were the things. And as I grew, then another role models came into my life. I did 3 UICC fellowships, 2 in Germany and 1 in US. The first fellowship, UICC fellowship, I did with Professor Bierzak, Hans Bierzak. I hope you know him already. He was a director of nuclear medicine. Now he's a retired professor. I went to him in 2004. And he was so well accomplished nuclear medicine physician there, and he was having a very state-of-the-art department there. And that was probably the largest center in Germany for isolation ward for giving radionuclide therapy. He has 30-bedded hospital in those days in the University of Bonn. So it was a great experience to work with him. And in 2 months fellowship, 2 months tenure, I did 3 papers, first author papers with him. So it was a great to write papers with him. All those guys are so big guys. Basically, in Germany, we call him Awas Alavi of Germany. Actually, he had, if you go through his CV, he had around close to 700 publications,
Wow.
and just 60 publication in JNM and 70 publication in EGNM. So those are the guys, and despite that, and it didn't ended up there actually. Then I did this fellowship with him 2004. Then he was visiting India, because one of his colleague from Germany, Dr. Torsten Fischer, he was heading the DFG division, German Research Foundation division in New Delhi. So he brought Dr. Torsten Fischer to my department in 2009, and he took rounds of our department. He took pictures of our department. They made a movie, and after his efforts, Professor Bierzak got Torsten Fischer, the director of DFG, to Chandigarh, and the Department of Nuclear Medicine at Chandigarh got recognized as a center of excellence by DFG to initiate collaboration with German institutes. So I could, after that, initiate many research collaborations with Dr. Baum, Dr. Bierzak, and few other centers. And we also initiated a student exchange program after this kind of recognition, which the Dr. Bierzak, who had been my mentor and a teacher, he initiated with us. So, and later on, I did one more fellowship with Dr. Baum in Bad Barka, Germany. So that was a great experience to work with him. I did 2 major publications with him on gallium. That time, gallium was not available in India. So later on, he organized the first World Congress on Gallium and PRRT in Bad Barka. And at the concluding day of this conference, he chosen me as the president to host the second World Congress on Gallium and PRRT in Chandigarh. So that was a landmark, historical event in my academic career to be the president of this World Congress. And this Congress was a great success. And 550 delegates came to attend this meeting at Chandigarh from over 56 countries. And not only that, after this event happened in Chandigarh, with the blessings of Dr. Richard Baum, the practice of gallium-68 PET imaging in NET and in prostate, and then the lutetium therapy and in prostate cancer and NET really picked up. And a lot of, international companies, they came to India, and all these gallium and other stuff, we got it at the affordable cost to our patients. So Richard Baum is also one of my greatest mentors. And the third USCC fellowship I did with Professor Michael Shoes from University of Iowa, where Dr. Michael Graham is the chair of that department. So after having this fellowship, most of the people from India will go and just do some fun, but I never did any fun. I will tell you very important event. Those days, 2004, we didn't have the smartphones and all, and we still used to take camera with the film roll into that. My wife given me that I like Germany, you get me good photographs. And for her surprise, I couldn't click even a single photograph. I just returned her the, unused film and the cameras actually. So
what a dedication.
Yeah.
So you always have, role models in your life at different stages. And my wife, who's Professor Squee Kaur, she's a professor of molecular parasitology in the Punjab University, Chandigarh, and currently she also took up as a dean, the position of dean in the Punjab University. So she's also a very, very important person in my life as a mentor and always a great friend. So you have different role models in your life at different stages of your life. So, but nonetheless, so I love them. I mean, my relations with them are not only academic, so we have social ties and everything. So just to conclude your this thing, I think I have said enough of my mentors. I will just like to quote that मालूम है कोई मोल नहीं मेरा फिर भी कुछ अनमोल लोगों से रिश्ते रखता हूँ. That's my take-home message. So
Very well said. Very well.
I'm very small person, totally from a village background, but I have great people who came into my life and who shaped up my career and my outlook.
Yeah, and extremely thoughtful of you to give them that. Very, very nice, Dr. Singh.
Yeah.
So, Dr. Singh, moving on to our next question. Could you please elaborate on your role in which you were nominated by ICPO Foundation, and also your role in while you were an international chair for Indo and UK radiation safety and security healthcare?
Yeah, this ICPO, the International Academy for Precision Oncology, is very dear to Professor Richard Baum. So we had a lot of discussion before he initiated this endeavor. So after he retired from Bad Barka, so he has taken up this position as president of the International Academy of Precision Oncology. This is based in Frankfurt. So the main purpose of this, Dr. Richard Baum always says that the nuclear medicine will expand only because of theranostics. Okay. And he has given, I mean, all of you will remember in Chandigarh, in his invited talk, he just said that he just is a warning kind of a thing to nuclear medicine physicians that the survival of the specialty lies in theranostics, and we have to get used to the precision theranostics, precision oncology. So he's a great propagator of this, and as a leader of this ICPO, he just hosted a meeting of at least 10 or 15 people from around the world, the presidents of various societies of different countries. And the main mission is to propagate this precision oncology. And they have took what are the challenges in different countries. I think the consensus was the main issue is inadequate training to practice theranostics. And we also need to have the trained dosimetrist to calculate all this dosimetry. So that was a take-home message. So he has he's trying to include various centers of excellence around the world to exchange students. If I'm not good in one particular, my center is not good in one particular aspect, I lack something, so I can send my students across to another center which are good there basically. So that is a harmonization of the practice of theranostics and around the world, so that we practice the precision oncology. So we use the right kind of approach, and he always says that one particular drug may not work, may work in one patient, but it cannot work in another patient. So we also have to have any center, precision oncology center should have all these genomic, proteomics, profiling facilities, and then you give the right treatment to the right person. That is the whole mission of this International Academy of Precision Oncology.
Thank you very much for elaborating that. I would like to also ask, you are a current president, and during this unprecedented time where history is being made, so applying your leadership in crisis, what are your thoughts on it? And really, truly, we salute you in being the president and, you know, having that role.
Yeah, thank you very much. It was really a challenge because we are already given the conference, the 52nd conference, annual conference to our colleague, Dr. Dhingra from AIMS Raipur. So there was a lot of pressure because on us, they were making the preparations to host this conference because the first kind of conference that was being hosted, that's a new institute. So, and we were having the Society of Nuclear Medicine office bearers, we are having back-to-back meetings, actually, what to do, how to do, and there was a restriction from the government of India not to host any meeting. But we just kept ourselves on hold, that we never said them no, we never said them yes. And then at the end of the day, we just took a call that let us, instead of just going to the virtual meeting, and let us go for a hybrid meeting. And the director, AIMS Raipur, Dr. Nitin Nagarkar, he's from PGI, he's a ENT surgeon. So he also wanted to have some kind of hybrid mechanism so that the conference is being seen as done there. So we decided to, let us say, we can have a gathering of 20 people, all senior people, junior people, office bearers of the Society to go on site and host a meeting in a hybrid mode. And we just got 2 months time for setting up this meeting, actually. All of you will know that. And at the end of the day, this meeting was a great success. I think this kind of meeting never happened before. And where the presidents of at least 9 to 10 international societies, they were the key speakers in this meeting, including IASNM and all of you guys. I think not even for a second, we could feel that this meeting is not a physical meeting. So it was virtually more organized meeting than our physical meetings. Everything and at the end of the day, it was a decision of Dr. Ashwin and other people as well to have recorded talks. Actually. That made the difference, actually, that we stuck to the time, and everybody, we got a lot of appreciation around the world that this is the best ever meeting we have seen, and in the given scenario, nothing better could have been done more than this. And most of the societies, I got a message from them that we should learn from SNM India how to hold meetings in this difficult times. Actually. So this was a great success, and I could barely escape myself being labeled as a COVID-affected president. So we did a great job, and everybody appreciated.
Thank you. Absolutely. And I truly second that. I've heard a lot about. Now I would go back to Ishani for her final question. Ishani, the concluding question.
Yes. So I have a special question for you. What is your concluding message for the generation to come who are embarking on their journey or are in their mid-career in this field that we treasure?
Yeah, that is a great thing. My mission is always that, basically. So, I mean, it is very, very fascinating that in the primitive years of nuclear medicine, and we didn't have many bright students taking up the nuclear medicine field, actually. So, nuclear medicine specialty is competing with radiology now. There are many, like PGI and AIMS. There are many occasions when the toppers who top the entrance exam, they opt for nuclear medicine. So we have many bright and amazingly intelligent students taking up the nuclear medicine profession now. So, I mean, my take home is that once we have the bright students coming and the specialties growing at a very rapid pace, and we have new and new tracers coming into the clinical use, I think, I mean, we need to modify our teaching methods, teaching modules, course curricula, so that all these people, young people who are torch bearers of our Society of Nuclear Medicine India and the specialty, they should be well educated to take up all these challenges which we are facing. We are having technological changes. We have a lot of tracers coming into being. So there, I mean, we have to really educate these students in a very nice and nice manner every time. We have to introduce new modules, teaching of modules, and the Society of Nuclear Medicine and the Indian College of Nuclear Medicine in India are very active in shaping up the career of these young professionals who are into our society.
Thank you very much for a wonderful message. I think I'll ask Chitra to now.
Thank you, Dr. Singh, for taking time out of your busy schedule and being with us today. I think now it's time for all of us to go out and have some chai. Thank you
Chai
again.
on her own. Chai on her own. So.
Absolutely. Thank you again. And we truly, truly appreciated your time today.
Thank you,
Thank you,
Dr. Chitra. Thank you. Thank you, Deepak.
Thank you, Dr.
Ishani. Thank
Thanks.
you.
Yeah,
It's
thank
a
you.
pleasure talking to you. Thank you.
An absolute honor. Thank you very much.
Thank you. Thank you, Deepak.
Thank you.